Hey guys, this is Curtis Alexander. I'm a pharmacist. In this video, I'm going to be talking about the medication Qsymia, newer medication used to help people lose weight. I'll go over how it works in the body. I'll talk about side effects, and towards the end, I'm going to give you some warnings that you need to know about if you want to talk to your doctor about getting started on this. Before we move on with that, make sure to go to my website, curtis-alexander.com. I have a free gift for you there, including natural ways to lose weight. It'll be in the description as well. So starting off, so Qsymia is actually a combination of two medications. One of those is phentermine. You may have heard of phentermine. It's a very popular medication to use on its own for weight loss, and it's coupled with a medication called topiramate. Topiramate is a seizure medication. That's what it was originally designed for. We can see it used in other things, mental health disorders and some other things. So kind of an interesting combination, right? So as far as what it does in the body, phentermine is basically, and we'll talk about this a little more, I'll explain the importance of this, but it's similar to amphetamine in the body. That's chemically, that's what it does. It's an anorexiant, it's a stimulant, okay? Topiramate, what we think it does, or what the end result is, it can give you a decrease in appetite and make you feel more full, okay? Now, as far as dosing, it's a medication that we start out low and we gradually increase it. The low dose is 3.75 milligrams of phentermine with 23 milligrams of topiramate. This is even much lower than the normal doses of these medications alone. So it is very low dose. They'll have you do that for a week or two and then start bumping you up. And the increase, what we want to see, what it's designed to do is that over a 12-week period, you want to see a decrease in 3 to 5% of that total body weight that you started. So the dose is going to be adjusted based off how you're feeling, how the weight's coming off, those sorts of things. It's not a medication that's designed to be used long term. We'll get into some of those things here in a bit, but kind of that 12-week mark, then reevaluate. But again, it's designed to be for short-term use, okay? Now let's talk about side effects. Oh, one other thing. You do need to adjust the dose for your kidney function, so if there's kidney issues, you want to stay at the lower end of the dose. But let's talk about side effects, you guys. All right, so right off the bat, a very, very common one is you can see an increase in heart rate. And this is going to depend on how, we're talking an increase in 5 beats per minute. 70 to 81% of people saw that. So your heart rate is most likely going to increase on this medication. That's primarily due to the phentermine. We can also see a decrease in what's called serum bicarbonate in 6 to 13% of people. I'll explain in the next section why that's important. Dry mouth, 7 to 19%. Constipation, 8 to 16%. Paresthesia is the feeling of pins and needles, 4 to 20%. And again, we have this range because of the dose that might be used. So lower dose, fewer side effects. As the dose goes up, you're going to be at this higher range. And then we see 6 to 11% can experience insomnia. There are other side effects. These are the most common ones. Now, what about warnings? Now, we're going to tie some things together here. Okay, so who should be very careful about using Qsymia? First of all, if you have any sort of heart condition, you want to be careful. Obviously, we talked about the heart rate, so that's important for you to know. Next thing, and this is popular, right, wrong, or indifferent, is the keto diet. And part of the reason we want to be careful, if you're doing the keto diet, it does put you at higher risk for metabolic acidosis. And this drug lowering serum bicarbonate can put you at higher risk for metabolic acidosis. So the combination of Qsymia and keto is problematic, but keto's the cure-all weight loss thing. That's what they say. So you should need to use Qsymia, right? So anyway, thought I'd throw that in there. Thyroid. You don't see this talked about in the literature, but I want you to keep something in mind. If you're doing anything that's going to stress the body or cause the body to release stress hormones, it's going to have a negative effect on thyroid function. Basically, as stress hormones go up, thyroid function decreases. One of the things with phentermine, because it's chemically similar to amphetamine, that's essentially releasing adrenaline, that's a stress hormone, so we could potentially see problems in people who have thyroid issues. And finally, diabetic patients, we want to be careful in that group as well. One last thing, dependency. Because phentermine is from a chemical standpoint, it's similar to amphetamine, so there can be a component of you becoming dependent on it. Another reason we want to use it on a short-term basis. So I am curious, have you used Qsymia? Know other people who have? Please let me know in the comments. It's helpful for other viewers. It is helpful for me. And I really appreciate you chiming in. Speaking of helpful, I hope this video was, and I'll see you in the next one. Thank you.